after fluid collection to ensure that the crystals are not affected by changes in temperature and pH. So earlier, we discussed that in the specimen collection, we must ensure that the anticoagulants used should not be powdered because it may precipitate crystals and may interfere with the crystal analysis, as well as specimens should not be refrigerated prior to examination. So for the reason again is because it may interfere with the crystal analysis and identification. So usually for crystal analysis and identification, we should use a stained wet preparation, although we can also use right stain smear. But the ideal specimen preparation is still wet preparation. Aside from that, we can also use the polarized microscopy as well as the red compensated polarized microscopy for identification. So these are the common crystals found in the synovial fluid. So here we have monosodium urate crystals, which is the main cause for gout. So it usually has a needle morphology. So in compensated polarized light, so negative siya. For calcium pyrophosphate, which causes pseudogout. Again, ang shape niya is rhomboid square or rods, which has a positive compensated polarized light. So for apatite or calcium phosphate, so again, it is significant because it may indicate that the patient has an osteoarthritis. So usually it requires electron microscopy, no birefringence. So we have cholesterol. So again, cholesterol has a characteristic morphology, which is a notched plate. So again, negative compensated polarized light. For calcium oxalate, again, indicative of renal dialysis, has an envelope-shaped morphology. Still negative compensated polarized light. For corticosteroid, so again, medications like corticosteroid may also precipitate crystallization. So its shape is flat variable shape plates. So it can either be positive or negative in compensated polarized light. So take note here that the synovial fluid must be examined first under polarized light and then confirmed, and the positive identification must be made into the compensated polarized light. So exclusively for detection of MSU and CPPD. So again, for MSU and CPPD, the preliminary screening for crystals is polarized light. And for the positive identification, if it is MSU or CPP, so compensated polarizing light or polarizing microscopy must be used. So compensated polarized light, the difference of that in polarizing microscopy is that there is an addition of a red color filter here. Okay, so what is the appearance of MSU and CPPD in polarizing microscopy? So the appearance of monosodium urate crystals and calcium pyrophosphate crystals in polarized light is that MSU looks like a needle. So again, needle-shaped crystal. It is strongly birefringent under polarized light. So for CPPD, so it is also birefringent, but take note that it is weakly birefringent as compared with MSU. So where is the CPPD in this illustration? So again, CPPD is a rhomboid or rhomboid crystal. So here is the CPPD crystal. So weakly birefringent rhomboid crystal, that is the calcium pyrophosphate crystal. So take note again for MSU and CPPD, they both polarize light at polarizing microscopy. So they are both birefringent. So how will you differentiate MSU and CPPD? So again, you will need to perform compensated polarizing microscopy. So for MSU, so MSU crystals under compensated polarized light shows yellow coloration. So it is yellow crystal. So it signifies negative birefringence in compensated polarizing microscopy. How about for calcium pyrophosphate? So in here, it shows positive blue-shaped rhomboid crystal in compensated polarizing microscopy. Again, take note, MSU, yellow, needle-shaped crystal, negative birefringence in compensated polarizing microscopy. Meanwhile, calcium pyrophosphate, compensated polarizing microscopy, it shows a positive birefringence, blue rhomboid-shaped crystal. So now we go next to the chemical testing for synovial fluid. So the most frequently performed chemical test for synovial fluid is the synovial fluid glucose. So if you can remember earlier, the most frequently performed test in CSF is protein. Okay, for here, for in here, synovial fluid glucose. So together with, rather similar with CSF glucose, for synovial fluid also, you should collect simultaneously the blood and synovial fluid specimen. So to ensure or to allow equilibrium of both blood and synovial fluid. So the normal synovial fluid glucose should not be more than 10 milligram per deciliter lower than the plasma glucose. So for example, in for your plasma glucose, you have 100 milligram per deciliter. So it means that the synovial fluid should be greater than or equal to 90. So at least lower than 100. So you just need to subtract the plasma glucose for 10, and then uh, the lower value or the lower threshold must be that value. So greater than or equal to 90. So take note, if lower than that, so if you acquired a value lower than 90, so it may signify different condition. Next, we have lactic acid. So again, just like in CSF, lactic acid is associated with septic arthritis. So again, it is associated with septic arthritis or septic conditions. So if there is a markedly decreased glucose, again, there will be an equivalent increase in lactic acid. So in this case, for synovial fluid, there's an increase in lactic acid by greater than or 30 milligram per deciliter. So aside from that, fluid lactate or fluid lactic acid is also used with acid phosphatase to monitor the severity and prognosis of rheumatoid arthritis. So again, it is used to monitor severity as well as prognosis of rheumatoid arthritis. Next, we have protein. So protein usually for the synovial fluid is less than 3 grams per deciliter. So when compared with the serum protein, it's approximately one-third of the serum value. So just like in CSF again, it is increased in hemorrhagic or certain inflammatory condition. Next, we have uric acid. So uric acid determination in synovial fluid is seldomly requested because usually the screening for uric acid is done on serum, and you just need to perform uric and you will perform uric acid in synovial fluid if you need to confirm whether there is really a case of gout. So okay, just in case if, for example, there is an increase in serum uric acid for a patient, and then if you want to know if there is a gout, you can perform synovial fluid uric acid. So in here, uric acid, it is equal in both the synovial fluid and blood. Okay, take note again, walang difference yung uric acid natin in both synovial fluid and blood. So, kanina sa glucose meron less than 10. For protein, we have less than 3 milligram per deciliter or about one-third of the value in the serum. For uric acid, it is equal in both synovial fluid and blood. Next, we have the microbiology tests. So these are the common organisms that infect synovial fluid or the joints. So we have Staphylococcus aureus, Streptococcus, Haemophilus, and Neisseria gonorrhoeae. Take note that Staphylococcus aureus is the most common cause of adult joint infection. So again, Staphylococcus is the most common cause of adult joint infection. So how about in children or in patients who are less than 2 years old or in children? So the most common cause of joint infections in patients who are less than 2 years old or in children is actually Haemophilus influenzae. Okay, so Haemophilus influenzae. So how about for Neisseria gonorrhoeae? So Neisseria gonorrhoeae actually infects or have a predilection among patients which are less than 30 years old. Okay, so among patients who are less than 30 years old. So, pagpasensya na po yung handwriting. So, dito lang kasi siya sa keyboard, wala po akong pen. Okay, so again, less than 30 years old. Pagandahin na lang natin. Okay, less than 30 years old. Okay. Again, don't forget, Staphylococcus, most common cause of adult joint infection. For Haemophilus, among children or less than 20 years old, Neisseria gonorrhoeae have a predilection among patients who are less than 30 years old. Next, for serologic testing. So serologic testing of synovial fluid is frequently done on serum, not on the synovial fluid. So usually, if you're trying to perform serologic testing on synovial fluid, y- the usual tests are actually autoantibody test or antibody test. So nowadays, di na siya ginagawa kasi yung antibody detection is being made on serum test. So if you're trying to confirm the presence of autoantibodies, dun pa lang pumapasok yung synovial fluid analysis. So what are the common autoantibodies being tested here for synovial fluid? So that includes autoantibodies in present in patients which have SLE or systemic lupus erythematosus and rheumatoid arthritis. So again, review lang po tayo. For SLE, again, for SLE, the most common or rather the most specific antibody for SLE is the dsDNA. Okay, dsDNA. How about for RA? So again, the most specific antibody for rheumatoid arthritis is not actually rheumatoid factor. So rheumatoid factor can also be present in other condition. So rheumatoid factor is again not specific for rheumatoid arthritis. The most specific antibody for RA is anti-CCP. Okay, anti-CCP. So anti-CCP stands for cyclic citrullinated peptide. Okay, again, cyclic citrullinated peptide. So again, it is the most specific antibody for rheumatoid arthritis. Aside from that, you can also detect antibodies towards Lyme disease. So again, why are you trying to detect antibodies against Lyme disease? So again, Lyme disease may present itself as Lyme arthritis, which is the advanced stage of Lyme disease or Lyme arthritis. Okay, next we now go to the questions or review questions for synovial fluid. So the question is, the synovial fluid easily forms small drops from the aspirating syringe. This viscosity is. So again, if you try to remember, the normal viscosity of synovial fluid is that it should be highly viscous. So at least it must appear stringy or it must form string within 4 to 6 centimeter. Okay, so any condition that may cause the lower viscosity of the synovial fluid means that there is a problem with the hyaluronic acid polymerization. And if you try to remember earlier, the condition that may lower hyaluronic acid polymerization is called arthritis. So arthritis or inflammation of the joint. So in here, the correct answer is letter C. Next, the principal mucin in the synovial fluid is. So again, if you try to remember, mucin is a high molecular weight uh, protein attached with a carbohydrate. So the characteristic appearance of a mucin is its ability to form gels. Okay, form gels. So what component in the synovial fluid makes it appear as a gel? Okay, or as viscous? So again, the component or the principal mucin in the synovial fluid is the hyaluronic acid or hyaluronate. Okay. For the next question, synovial fluid is analyzed with a polarizing microscope. Strongly birefringent needles are seen. This most likely indicates. So again, the determination for MSU and CPPD crystals are made by using polarizing microscopy. And then the positive identification or the confirmation is made by using compensated polarizing microscopy. So in here, it only dictates or indicates that it is analyzed with a polarizing microscope. So it means that both MSU and CPPD are birefringent. But take note, in here, the given is the in the keyword here is strongly birefringent needles. So again, isa lang yun. Strongly birefringent as well as needle shape yung crystal. So that's monosodium urate crystals. Next, which of the following could be the most significantly affected if a synovial fluid is refrigerated before testing? So again, if you try to recall, uh, refrigerated is actually avoided here in synovial fluid analysis because it may interfere with crystal analysis. Again, aside from refrigerated specimen, you should also remember again that the anticoagulants being used here for synovial fluid must be liquid form. So again, if you use powdered anticoagulants, it may interfere or may precipitate crystals and interfere with the crystal analysis. So a paired fasting plasma specimen was collected at the same time an arthrocentesis was performed. The difference in the glucose between the two fluids was 55 milligram per deciliter. So this result indicates an So again, for synovial fluid glucose, the comparison between the synovial fluid and the plasma glucose is that the synovial fluid is less than 10 of the value of the plasma glucose. So for example, again, if there is a 100 milligram per deciliter plasma glucose, the value for synovial fluid should not be less than 90. So in here, the difference given is 55 milligram per deciliter. So given a normal paired fasting plasma or 70 to 100, which is the normal fasting plasma or fasting glucose, uh, it can be inferred that 55 milligram per deciliter is actually big number. So it is mataas yung difference between the synovial fluid and then the plasma glucose. Okay, so the answer here may indicate, of course, septic condition. Again, of all the conditions here being given, the septic condition will manifest the highest decrease in glucose. Okay, same with CSF glucose. So again, markedly decreased yung glucose for septic condition or bacterial condition. Next, a synovial fluid collected using a sterile syringe and then transferred to collection tubes for testing. Which of the following anticoagulants would be appropriate to use for the aliquot sent for a manual cell count and crystal evaluation? So here, and what is the anticoagulant should be used for manual cell count and crystal evaluation? So again, manual cell count and crystal evaluation. So just from the first look, alam mo na kung anong anticoagulant being used because it said cell count. So for cell count, you can use EDTA. But in here, there are two choices. You have liquid EDTA and powdered EDTA. Okay, so again, in the previous number, powdered anticoagulants must not be used because it may interfere with crystal analysis. So the answer here is letter A, liquid EDTA. So sodium polyanethol sulfonate is being used for microbiologic examination of synovial fluid, sodium fluoride naman for glucose analysis. Okay, next we have the amniotic fluid. So amniotic fluid is a protective liquid contained by the amniotic sac of a gravid amnion. So amnion is a protective membrane that encompasses a fetus. And in the amnion, it is lined by a specialized membrane called amniotic membrane. So in the amniotic membrane, it will eventually expand because there is also an equivalent increase of the amniotic fluid. So amniotic fluid is involved in the exchanges of water and chemicals between the fluid, the fetus, and the maternal circulation. So the primary function of amniotic fluid is the same with CSF. So it acts as a protective cushion for fetus, fetal movement, stabilize temperature. But take note here, the most important function of the amniotic fluid. So it permits proper lung development. So why does it permit proper lung development? Because amniotic fluid also contains lung surfactants. Okay, lung surfactants necessary for lung development. So how about the amniotic fluid volume? So during the first trimester, approximately 35 ml is derived from maternal circulation. During the first trimester, so the volume of amniotic fluid is determined by the maternal circulation. After the first trimester, the major contributor of the volume of the amniotic fluid is the fetal urine itself. So yung first trimester derived from maternal circulation. After first trimester again, it is dependent on the fetal urine. Aside from the fetal urine, latter third and half the pregnancy, kasama na ni fetal urine yung mga lung liquid natin or lung surfactants again. So yung mga lung surfactants na dapat natin tandaan includes lecithin, sphingomyelin, and phosphatidylglycerol. So these three are needed for proper lung development. So lecithin, sphingomyelin, and phosphatidylglycerol. So during the third trimester, the amniotic fluid volume peaks at 800 to 1,200 ml. So this is the normal volume of amniotic fluid, 800 to 1,200 ml.